Governor of Machakos, Dr. Alfred Mutua, karibu sana to Debrick.
Asante sana.
Your first time this year?
Yes, my first time this year. Habari yako?
Salama sana.
And Happy New Year.
Happy New Year to you.
I've not seen you the whole of this year. Mwaka imesonga na tujaonana. Tunakupatia salamu za heri.
You make it sound like it's been so long.
I know it's just 2 weeks.
All right, so maybe we start from the point of view of Machakos. How is it the new year and your plans in terms of developing the country, and how receptive is the county in terms of all this?
No, Machakos we've started very well. We launched Kivandini Masinga Road that was under construction. This is a road that opens up Masinga sub-county, which has basically never had a tarmac road. So kids are seeing tarmac roads within their sub-county for the first time. So the headquarter never had a tarmac road. It's about nearly 20 kilometers. Horrendous place. I mean, the dust and everything. So we've opened up that area. We have ongoing other projects in Kidhini area in Machakos sub-county. We've got in Mudhedheni area where we're building an 8-kilometer link road. So we've started with work. I launched a dam. It's a very big dam. It's 100 million liters of water, bigger than the Solai Dam that collapsed. So this dam is going to help the people of Ndalani Niata, which is a very dry area. And we have purified the water, we've cleaned it up, pumped it up to a tank, and we're piping it to homes. So about over 20,000 people.
Were you commissioning or you are launching the construction?
I was commissioning. The dam is done.
Does it have water?
It's finished. It's got very little water because
so waiting for the rains.
So waiting for the rains.
Okay.
But the water it's actually being used. The water that is there will last at least 2 to 3 months as wait for the rains. So it rains heavily, people are going to move because that's what people want. People want things that change their lives.
Quite a good report, Governor. But a while back, I think last year and the previous year, there were issues with the quality of roads that you are constructing. In 2013-14 or thereabout, there was a problem with the road that links Machakos to Mwala. Or is it? No, wait, Katangi to Mwala. There are complaints about that. And there's another road that I witnessed myself in Kathiani area that, yes, it had the tarmac, but when you look at the quality, it's not up to standard. It's not exactly what you see on other roads. How are you dealing with the quality of roads?
You have to make sure that you're talking about the roads that I make. Because there are roads that are built by Governor Mutua, there are roads that are built by Kura, there are roads that are built by Kera and others. So, for example, the people of Yatta were complaining because they have not had a road. And you see, the Yatta sub-county has roads that pass on the side. You know, there's the road to Kitui and the road to Garissa. In between, 45-50 kilometers, no road. So we are actually now constructing the road. The road to Kadiani, you're talking about are roads that were made during the colonial era. Those are not my roads. It's only that the roads have not been maintained, which is we need to get a regiment of maintaining. When I build my 33-kilometer road, which you should visit, that's a road between Mwala and Kidimani in 3 months. It's nearly 6 years ago now. The road is still there, just as good as any other roads. So there's never been a real complaint about road. There's propaganda and there's a reality on the ground. And you have to realize that as reporters, you should go and take me and tell me, is this the road you build? Take an engineer from Kenya, take an engineer from Japan, don't even take me and ask them about the quality of the road. Because we build those roads according to the standards that are put there. And they're there. So let's not listen to propaganda of people who are trying to put us down because they're afraid that our development is making us popular.
Fair enough. Let's focus on why we are here. And primarily, we know that when is it? In November, you started off the registration of the citizens of Machakos County into the universal healthcare. And this is a program that aims to ensure that the citizens in the 4 pilot counties, for a start, can access quality healthcare without financial burden. In a sense that if they need to pay for it, then it is within the economic ability. How is that going, and how many have you registered before we even get into the workings of that program?
We're looking at already close to 700,000 people out of a target of 1.2, 1.3 million. So we are doing very well. And what we are doing is that we've told people when you come to hospital, you cannot be treated without registration. So we have registration points in hospitals. So you get there, you are not registered, you go to a desk, you get registered, you come back and you get treated. Every program has teething problems, but this one has started very well because all we've done is waive the fees and make sure that they are...
What fees?
You see, there are fees when you go to like level 4, level 5, you have to pay certain fees, you have to buy the medicine, you have to pay for the x-rays and some of those things. Now we've made it absolutely free of charge. All you have to do is show up. But you see, it's not just about getting free service, it's about getting quality service. And that is where we are going. We're very lucky, Machakos. We have one of the best, I think, facilities in terms of health facilities in Kenya. Patients come all the way from Nyahururu. Patients come all the way from Kajiado. Why? Because in Machakos, you don't share beds. Our pregnant mothers, when they're going to deliver, they shower with hot water. We've improved our level 5 hospital. We've improved our health centers. We've pumped in a lot of money in healthcare. But we're also trying to revamp the systems to ensure that our systems are equivalent to those of the private sector. Because it's about quality, not just free and quantity.
So when... Good point. So when you say that 700,000 citizens of Machakos have already been registered into this universal health care, and they're accessing the health services free of charge,
yes.
How are you financing this?
Well, what has happened is that we already have the financing that we have as a county, which is our budget. But then we have this program with the national government through the World Bank, funded by the World Bank, of close to 4 billion shillings. So we are getting extra funding. For example, KEMSA has been funded to provide medicine and equipment to Machakos. So that's not coming from our budget. We are getting money, capitation money, going to facilities to improve the quality of their facilities. And then we can also buy medicine that KEMSA is not giving us. So we've got all those things. We've got extra money now where we want to add the number of health workers that are there, because you need more health workers. People need to work in conducive environment so they can be able to actually give proper service. So there are all those things that we are doing right now.
So the financing primarily is coming from the national government and the financing by donors. So
it's coming from, I don't think we have donors anymore, maybe development partners. Yeah. You know, we don't call them donors anymore. Kibaki changed that. Okay. Tukasema we don't want donors, we want development partners. You come and partner with us. It's our program. If you don't want, then we'll still continue the way we are. But anyway, I'm just kidding. So, so the World Bank has funded the national government for a pilot study of this. And when I talked to President Uhuru Kenyatta, he's really committed to rolling out universal health care in the whole country. And I think he will succeed because other countries have been able to do it. And as you know, Uhuru Kenyatta is all about development, and the quality of life of wananchi. And so we want to get it right. And the pilot study is supposed to identify challenges, identify holes that need to be plugged in, identify costs, so that when it's rolled out to all the counties, it is something that will be able to work. So we are a trial, this is a trial period. Okay,
so it is the pilot phase, but eventually when the country decides that it's actually a good program and it's working, where will the financing be coming from? Is it from the development partners, as you call them, or will it be from the county?
They'll come from the exchequer. Because the calculations you're making is that maybe each county needs, I don't have the figures, maybe 1 billion shillings. We have 47 counties. So that's only 47 billion. That's 47 billion shillings. I mean, really, we can afford that. We can afford 47, we can even afford 100 billion from the exchequer to fund our healthcare. Because there's nothing as important as health. You know, without proper health, there's no economic growth. Without proper health, people cannot really enjoy the life they have. So this is so important. It's just as important as roads, just as important as other things. And the money we blow away in politics and corruption, if we tighten those ones, we'll have even double the money we need to provide healthcare to each citizen. For
the sake of information, Governor, we know that in this country there has been a drive to ensure that every family is under the National Hospital Insurance Fund, NHIF. Now we have universal health care that requires you to have a card, to be registered and issued with a card of UHC. Where do these things reconcile?
Actually, the system we're using is still the NHIF system. But you see, in our country, there are different types of people. There are people who can really afford to pay something small to get advanced medical care. But then we've got people who are living in abject poverty, who have to choose between feeding their kids or buying medicine. You know, they have 100 shillings. Nitanua sukuma wiki, na ugali watu wasile njaa, ama nitaenda ninunue zile dawa to heal my pain. People choose to feed their kids. And so we get mortality rates. People get sicker and sicker, you know, because they cannot afford just basic health care. So this is not just an issue of development, this is also an issue of human rights.
Okay. And I want to take you to some statistics that, based on the Control of Budget report of 2017-2018, we know that Machakos County had a budget of, after supplementary budget, was about 10 billion shillings. But the allocation to the health department was 3.8 billion shillings. If we can have that slide, the allocation was 3.8 billion shillings. But according to the report, the expenditure was a total of 436 million shillings, showing an absorption rate of 11%. Of course, the development allocation was 881 million shillings, but the actual utilization, or the money that you spent on development of the health sector, was 159 million shillings. That was 2017-2018.
Yeah, it's because also majority of that money went to salaries. You have to realize that in between those negotiations with the doctors, the doctors went on strike in this country. The nurses went on strike. So the monies that were to go into the development aspects of healthcare, that were going to services, were moved to pay salaries. That's basically what happened. So all our plans actually went downhill. But you see, we have invested, because when you invest in healthcare, in paying employees, in paying doctors, in health workers, it's still an investment in healthcare. So my budget right now, I think basically 40% of my budget goes to healthcare.
I'm trying to get the figures that based on the budget of 2017-18, your recurrent expenditure had been put at 3 billion shillings. The development expenditure was 881 million shillings. But when it came to actual utilization, the much you spent on recurrent expenditure was 276 million against 3 billion.
No, it doesn't add up. That would mean that the doctors will not get salaries.
That's the report I'm reading.
Yeah, I think there's something wrong with your figures. Because you can't have 3 billion, because you can't have 3 billion for recurrent. Recurrent pays medicines. I mean, one order from Kempsa himself is about 300 million. So that, to start with, is already wrong. You can't be spending, I think you might be talking about, you know, over expenditure of the budget with an additional 276 million. It is not under expenditure. Because recurrent expenditure pays for electricity, pays for salaries, pays for medicines, pays for fuel for the ambulances and everything. So you can't spend 276 and still be able to operate. Well, because the doctors themselves, the salaries, the wages of the healthcare workers is over 2.5 billion.
Well, that's based on the control of budget report. That is, what's her name, Agnes Odhiambo, which you dispute. But nevertheless,
no, I don't dispute that report. I just
the statistics that we look at these would indicate to you that there's a challenge in as far as spending money to develop the facilities that you have.
Not in Machakos. Actually, our challenge in Machakos is that we don't have money to develop what we want to develop. We are in the middle of building 40 community hospitals, which nearly collapsed and basically, you know, failed because of lack of funding. But we are back on. We have renovated our health centers. The challenge we have is we don't have enough cash to do the work we need to do. We need to build a new health center in Machakos town. We need to build a new level 4 hospital in Machakos, you know, town area, just for example. We need new dispensaries and health centers. We just don't have the money to do it. If I had the money, I would just build it and use it. So there's a challenge. And you know, Machakos is a bigger county than the others.
Sure. And
so we have higher, you know, higher expenditure. But also, we have provided quality healthcare. You know, when we say people cannot share beds, when we try to provide medicines, basically all type of medicines everywhere that are needed. So we've got our challenges, but in terms of healthcare, I think the World Health Organization should come and do a study, or UNDP, or even yourselves, and you'll find that among all the counties, we provide the best healthcare to our people. Despite all the challenges.
Despite all the challenges, you say. But you're saying that you are short of cash. You have financial challenges. Obviously, every other country has that, because apparently it appears that we spend so much on recurrent expenditure, understandably so. But when devolution was rolled out, the intention was that there would be exchequer releases, that the financing based on the county revenue allocation. But also, the county itself is supposed to generate its revenue. I want us to look at some statistics of how you have been doing since 2013-14. And in 2013-14 financial year, you were able to raise 1.17 billion shillings. 2014-15, you went up to 1.35 billion shillings. 15-16, you went down to 1.12 billion shillings. In 2016-17, you went up again to 1.25 billion shillings, and in 2017, you went down, 15% decline to 1.06 billion. So that's the latest we have according to the control of budget. So looking at this revenue generation as a county, why is it so hard to raise this figure so that you have more resources to use on development? Is it that you have done everything that you could within the wealth you have in Machakos?
No, but I think your figures, you're catching your figures wrong. I think you're reading reports that are maybe what are called, Control of Budget also releases supplementary reports that are not
the annual report.
Yeah, because the last year we were able to raise over 1.5 billion, and we did so well that we were among, I think, 7 counties.
Which financial year?
The 2016, 2017. 2017, 2018. So in a way, in such a way that we've actually been given a reward. We've been given an additional 160 million because of our increase in raising revenue. I think it's us, Mombasa, and a few other counties. So we've actually been rewarded in terms of we've raised more revenue. Our growth of revenue has improved over the years.
How are you executing this?
We've been trying to tighten, but my feeling is, and this is where I'm very happy now, because with the coming in of, we are trying to negotiate with KRA, because my feeling is that we should be collecting at the very minimum 4 billion shillings. But a lot of our taxes are not collected. There's a lot of gaps. There are, even in Kenya, where taxes are not collected. So we are entering into an agreement with KRA, so that KRA can actually collect taxes on our behalf, because we think they have an efficient system, they have a tried system, and once we do it that way, I can now get the revenue to be able to support the works that I need to do for my people.
Okay. Let's now focus on the financial year 2017-2018 again. That is, if we have that slide of how much you spent in your budgetary allocations, the salaries or personal emoluments, you spent 4.8 billion shillings. If you can have that slide, then yes, there it is. Salaries, it was 4.8 billion shillings. That's 65% of the resources that you had been allocated. Operations took 1.5 billion shillings. That is 21%. So if you do calculation 21 plus 65%, that is 86% going to salaries and operations. For development, it's 14%. That is 1.02 billion shillings. I don't know whether you dispute these figures, but whatever the case, you can see that only 1.02 billion going to development, and I thought that the recommendation is that you need to use at least a third of your resources. Why is this the case?
And this happened because of the doctor's salaries.
Only?
Yeah, basically that's it. All this, we added another 1 billion to just doctor's salaries, the salaries that were there. It's basically that's it. That's what happened. Our budget, we had to go back for supplementary. Our budget just went haywire because we had now to pay for all these extra costs that had not been budgeted for. So it went haywire. Our operations also increased in the country. As you know, there was a problem with the cost of fuel. Whenever fuel increases nationally, you find that the cost of everything increases. Even the cost of what we are doing in the county increases. So we find operations rose. The economy, it's the same if you look at the national government. It's the same, kabisa, national government. There was nothing special about Machakos. So there was that of expenditure. But now we are getting back into getting more money for development. But the reality is we cannot really sustain the huge wage bills.
What's the size of your workforce?
I have about 6,500. There were about 7,000, but I want to bring it down to about 5,000, out of which about 80% of those were inherited. Actually, over 85% were inherited. How
many do you need, ideally?
I think I can do with 5,000.
5,000.
But you can't just get rid of people.
No, I'm asking in terms of a service delivery.
5,000 are enough for me, if everybody is working properly.
Good point. Now, I want us to focus briefly on how revenue is allocated to these counties. And previously, from the previous financial years, we've heard that the money that is allocated to your county, that is the it depends on 45% based on population, 26% based on equal share factor. That is 26% of all the resources. If you decide that this year you're allocating 314 billion shillings, 26% has to be allocated equitably, or rather equally, to all the counties. And then 18% goes to the poverty factor. So if you have a higher poverty factor, then you have more resources based on that. And then for land, it is at 8%, 8 nane. That is the land area factor. And for the fiscal effort, that is the efforts that you're making to generate more revenue, then that takes about 2%. And then 1% is based on the development factor. I would imagine that is on the development needs of our region. Now, there's another conversation that is coming through, proposed by the Commission on Revenue Allocation, that indicates that they would now want to move away from this and focus on the services and the functions that these counties are executing. We understand that the service delivery will be taking away 69% 10% of resources, and then for development needs, it should be about 26%, and then for revenue and efficiency, based on how well you're doing, that would be 5%. So when you look at this formula and the resources that you've been receiving over time, which is the better formula?
I think either can work for me, because it's not about the formula, it's about how you utilize the monies that you have. Whether they're given to you through the old formula of population and everything, whether they're given to you through this new system of service. I tend to lean towards service-oriented. You see, you look at countries like Singapore, for example. In Singapore, your budget goes down according to how you use it. And you can actually wipe out a whole ministry if they keep on returning money. It's about delivery and about using the money efficiently, not just spending the money. But I just think that we've not really cracked how counties should receive their money. Yeah, because when you peg it on population, what happens to areas with very low population but have vast needs that need long areas where have long distances that need tarmac roads, which they don't have? What about areas that have high populations but they're already developed? They already have the infrastructure, they already have the water systems, whereas another one may be middle but does not have this. So there has to be a good combination of a need-based funding. What is the need of these people? And maybe we should have a criteria that says, what is the life, what's the quality of life? What's a basic quality of life of a Kenyan? So every Kenyan, we decide, should live in a house that does not have grass. Like, for example, I'm giving mabati so that you don't have grass-touched houses. You say a quality of a Kenyan should have proper health care, a child should have this, should have so many meals a day, should have this kind of income. And then when you decide what a Kenyan should have, then what does it cost to fund a program to ensure that Kenyan gets that? And then you look at the poverty levels across and the ability to do that. Then you can fund it based on the need of a Kenyan. So you're not funding just a county, you're funding a Kenyan.
Are you making contribution to that discussion with the CRA?
Yes, we are very fully engaged at the COG, at the Council of Governors.
Wish you well on that. I just want to take a few questions before I go back to the Ukambani politics. Someone says that I am disturbed because of water. Survey to sink a borehole was done in 2015 at Mwala. As at now, same not done. Why? I can see the governor to explain more.
Yeah, but it depends where in Mwala. Mwala have dug, I think, more boreholes than any other place, over 100 and something boreholes already done in Mwala. I have already 410 new boreholes run by solar that were not there before I became governor. You cannot do everything overnight. You cannot be able to supply water to every household or every place overnight.
But the needs of this view are not waiting. 2015 there was a survey.
Yeah, there was a survey.
2019 there's no borehole.
Yes, but you see, we are still rolling it out. It's all about financing. You know, it's expensive to dig boreholes. I have dug more boreholes than all the other 47 governors combined, because I bought my own machines. I was able to hire my own people, and we were able to do it. But you see, you also at times hit a dry well. We hit a lot of dry wells. You do a survey, you go, you hit a dry well, there's nothing. At times you hit them, the water capacity is not that good. Once you measure it, you'll find that the water has too many chemicals. It is not fit for human consumption, so you cap it and you leave it and you go to another one. It is basically water harvesting. But also what we've been doing is also we have dams and ponds. We have over 208 dams and ponds in Machakos County. I have over 173 waterways in rivers. We are rolling that up to 500. And is this water piped, or people have to go fetch it? You fetch it, but we're also piping. We are building huge tanks. We're in the process now. I was just looking at one the other day when I went to Masinga in a place called Ekalakala. In every of these towns within the next 3 years, we'll have huge tanks. Already I'll be commissioning a few. 50 to 1,000, 100,000 water tanks that are raised, and then it's reticulated. My program, which I'm on track, is to have piped water basically in every household in Machakos.
I heard you. Governor Mutua, I covered your campaign in 2012, and I heard you clearly talk about the showers. Make those promises and the showers. 2012. Now we're in 2019. 7 years down the line. But have you come to Machakos? No, I'm saying. Yes. No, I made the promises. No, but you see, it's a journey. It's a journey. You cannot make a promise and roll it out all at once. But where were we? At the time when I became governor, the household coverage of piped water was at 8%. The household coverage of piped water today is at 35%. We have improved
we are getting to the 100%. You cannot do everything all at once. You cannot dig the boreholes, pipe the boreholes. We don't have the resources. If I had the money, today every household would have a shower. All you need to come and do is look at the national statistics. Don't look at Mutua. Go to the National Bureau. Find how many households had water before Mutua became governor. Down the line, find out how many have water, how many are in the pipeline. By the end of this year, 2019, about 50% will have pipe water. By 2022, at least 80 to 90%.
Governor, there's one view here. One viewer here who is asking quite an issue that is affecting them. What is he planning about Kany Dispensary, which doesn't have toilets for patients and stuff since 2016?
Well, those are, as you run a government, there are so many small units. There are dispensaries, there are all this. The governor cannot know exactly what is happening in all these places. But that's why I'm tweaking my health department. I'll be doing a major reshuffle within my health department so that people can deliver. People can deliver, So, a governor runs a county.
So you move staff or you fire staff?
Heads will roll. And
what does that mean?
People may even get charged for corruption and all the things that have denied my people services. Because people have to get services. This lethargy of the public sector, whereby you can come to you can go to a private sector building and the toilets are clean, things work, services are efficient, you are served. You go to a government office, you know where the toilet is because you follow the smell. We want to cut that lethargy. And then government needs to work as well as the private sector. So
that's the promise from the governor. I want us to briefly talk about the situation that is affecting Ukambani region. And recently we have seen you with your colleague governors, Governor, I almost said Mama Ngilu. Well, I just said Governor Charity Ngilu of Kitui and Professor Kivutha Kibwana of Makueni. And you guys appear to be forging what you're calling People's Empowerment Program.
Movement.
Yes, movement. Once upon a time was Maendeleo Chap Chap movement. It became a political party. And now we have People's Empowerment Movement. What is this movement moving to?
This is it's a socio-economic movement. And what we've decided to do is that we have realized that our people have been shortchanged over the years. And as Maxwell said, everything rises and falls on leadership. And because our people have been shortchanged for a long time, we don't want to get to a place where people will ask us, you are in positions of power, you had the ability, what did you do? How did you change your lives? When we look, we analyze where Ukambani is, strategically placed, the resources we have, the factors of production that we have, labor, land, all those things. What we have and where we are in contradiction. We should be much better than where we are.
In this meeting, like you can see the pictures running on the screen, in this meeting between the three of you, of course, there's the vision that you're saying that you want to take your region from this level to a higher level.
Yes.
Is it just about that, or is there a political ambition? Because you, Governor, let me just finish the question. Your term expires in 2022, so does Professor Kibwana's. Is there any political agenda that we are not seeing?
No, right now the agenda is, let me tell you, leadership is political. Leadership is political. So we cannot come together as leaders who are political leaders and you say there's no political move. And the political move we have is changing the lives of our people and freeing them from the yoke of poverty and sycophancy that has been there. We've had leaders over the time, and you have to ask yourselves, have our leaders really developed as the way we should have been developed?
Which leader are you talking about?
All our leaders from the beginning. We've got very good leaders, and we're asking ourselves in the region, have we been shortchanged in terms of getting our rights and getting services? And then you look at the politics that are there today. We are saying that the people need to be the ones deciding, not one or two people.
Governor, I asked you which leader you're talking about. You wouldn't say it. Let Governor, Senator Muthama say it for you. If you have that clip, you can play it and hear what Senator Muthama had to say about the meeting of the three governors.
To equal Kalonzo, eti wanataka kuwa rais wa Kenya. Watu nani amewaroga jamani? Nani aliambia Kivutha kuwa rais ni kusimama Makueni? Nani aliambia Mutua kuwa rais ni kusimama Machakos? Ngilu kuwa rais ni kusimama Kitui? Kiti ya Kenya ya urais inaitishwa kutoka Lamu mpaka mwisho wa Kisumu. Kama wao ni wanaume na wanataka kuitisha kiti ya urais, nataka kuambia Kivutha aende Mombasa Tononoka aite mkutano iingie watu 1000, nitaambia Kalonzo aende nyumbani. Na yeye mtu aende Masai Land, hapa Masai, aite mkutano ije watu 500, nitaambia Kalonzo tuachie Mutua. Lakini hata umbwa wao nyumbani wanaowalisha, wakisikia wana mkutano wa kuitisha kiti ya rais, hakuna umbwa hata moja anaweza kaa nyuma yao.
Well, you know, the kind of talk, that is what has led Africa to be the richest continent in resources, but very poor. You know, I don't want to lower myself to that kind of thinking, you know, because democracy is about ability of people to be able to rise and be able to achieve. And it is kind of sycophancy, thinking that it's only one person who is able. It's only one person who is able. And we have to protect this one person, because we don't think others are able. You know, it's a kind of argument you find in the old days when people used to say that the earth is flat. You know, Mudhama would have been one of the people saying, "Hapana, hata umbo atakwambia the earth is flat." Kila mtu anajua the earth is flat. So when you say that the earth is round, they'll say, "Hakuna, hawa ni wajinga, hawajui dunia inaweza kuwa round namna gani, ni flat tunajua." You know, that kind of you know, simplistic thinking. And so I don't want to get engaged in replying to somebody who's really has not contributed much in terms of helping our people, apart from causing infighting, apart from insulting our people.
And I want to ask you a specific question, because that is the interpretation of Senator Mudhama,
yes,
in his own right.
Which is good.
There are several other leaders, including the senator for Kitui, yes, and some members of parliament from those 3 counties that have come to speak against you.
Yes.
So the question I want to ask you, do you want to dethrone Kalonzo Musyoka from the leadership of the region?
We want to free our people from the slavery of empty politics to the politics of development. We want to move our people from poverty to prosperity. We want to move our people from a sense of apathy and helplessness to a sense of hope. We want to galvanize our shared resources so that our people can enjoy the fruits of independence. We want to galvanize our people to have a national position in terms of the referendum, the census, and everything that is done in a way that does not benefit an individual but benefits the community. What we've had with Mheshimiwa Kalonzo Musyoka has been a dictatorial system. And you can see it. His sycophants are the ones that are afraid. What are you afraid of? Mutua has not said they want to take Kalonzo's position. Kibwana has not said they want to take Kalonzo's position. When we say we want to run for president, you have to ask yourself, is Kalonzo electable as a president of this country? Do Kenyans trust Kalonzo with his wishy-washy stance? Do you want a chief of staff, a commander-in-chief of the defense forces who is in this camp today, is in another camp today, tomorrow is here? Do you want somebody who cannot make their mind? You know what I mean?
He's still the party leader of Wiper.
He's still the party leader.
And an NASA principal.
But we're asking ourselves, do people outside Ukambani trust Kalonzo Musyoka to be commander-in-chief of the Republic of Kenya? Because we are saying this. You cannot become, and that's where Mudhama is correct, you cannot become the president of the Republic of Kenya if you're only getting support from your backyard. You have to get support from across the country. And we are saying that we, the 3, one of us among the 3, would do much better if we decided to run. I'm decided to run. If the others may decide to run, I know I'm going to run. But the agenda we are doing today is that we are not telling people, elect me to be president. You have to say, why do I want to be president? Why does Kalonzo want to be president? Why does Ruto want to be president? Why do these people want to be president? So that they can be in positions of power. You are president so that you can move people, you know, from that island of poverty to that, you know, place where they're supposed to have been a long time ago. Our youth are walking around without jobs. Our women are walking around, you know, without any money in their pockets. Our fathers are tired of eating dust because there are no roads. We want leadership that transforms our country. And you cannot say that this leadership is only for a few people. And that is basically dictatorship. And it is that control whereby you say ni huyu peke yake that denies the African continent. Why do we have leaders in the African continent that work forever? It's dictatorship. So this, what they are perpetuating, saying ni Kalonzo, ni Kalonzo, ni Kalonzo, I think I am more electable nationally than Kalonzo Musyoka. Kwa hivyo yeye ananiharibia. So people wanasema mimi namharibia. But in reality, yeye ananiharibia. I am younger, I am energetic, I can do more, we can work together. And I'm saying that this should not just be about 2022. This should be about our people. And we want to work with everybody. And so we've said, and we had a strategy meeting, we said, politics ikae kando. Let's talk about empowerment of our people.
All right,
and
Governor,
that's what
I want to
are
cut you so that I can look at some of the feedback. Someone is saying that, Governor, the earth is not round, but oblate. Do you have some more, more feedback?
It's good, yeah. At least they are closer than the people who are saying it's flat.
No. You're accusing them of saying that. So, Binjo P says that good work you are doing there, boss. However, why have you failed to employ ward administrators to advance devolution at the grassroots?
I have ward administrators, I have village administrators, sub-county administrators. Maybe they're not aware, but they're already in office.
All the wards?
All the wards.
Okay.
I have 40 ward administrators, I have deputy sub-county administrators, I even have village administrators. Yes.
I just wanted to look at one tweet that has come through here. County governments need to speak up, create awareness on universal health care at the grassroots level, and most importantly, mobilize and utilize resources efficiently in support of quality, affordable health care for all. That is Mashari Anjeru, who is tweeting us on Daybreak. And finally, Neo Mutua was inciting other Ukambani governors, and he will fail badly.
Well, they say the same thing.
That is Isaac Muthusi.
Yeah, they say the same thing when I was running for my second term. They said you can't go against the direction. You know, when I was listening earlier on, somebody tweeted and said that Kalonzo is 300 what did they say? Miles ahead. Yeah, he's 300 miles, but going the wrong way. That's our perspective, and enda the wrong way. You know, and you know, because it's a way whereby if you go to his village, you go to where he's born. You know, how can you be the only person with a nyumba agorofa? Everybody else is in poverty. Wow. How can you be in a place? And the fight we have with Kalonzo Musyoka, let me say it clearly so that Kenyans understand. It's hypocrisy. And what happens is this. Last government, or last session, Kivutha Kibwana could not work. We nearly dissolved Makueni. The Wiper MCAs impeached Kibwana in Makueni. Wiper MCAs impeached Kibwana. In Machakos, we had Mudhama and others causing wrangling. They said, Mutua kuna mali anaenda. Mutua, your history imeandikwa, you're finished. We come to this term. Kibwana joined Wiper. Now he's the chairman of Wiper. Now Machakos, because they had a court case and everything, walikuwa wananisumbua, they have not passed my things, wananisumbua. Now wameanza kusumbua Mama Ngilu. The same Wiper. Mama Ngilu anasumbuliwa sana Kitui. They are trying to remove her. The same Wiper people now have started insulting Kibwana. They're telling Kibwana, get out and go. So we're asking ourselves, is there something wrong with the Wiper? When you become a member of Wiper as an MCA, is there something wrong that gets into your blood? And we realize,
Governor, unfortunately, we're out of time.
Can I finish the thought? The problem is the leader. The leader who kujua anajifanya mtu wa amani, but he's constantly using the MCAs.
Let's be fair as we end this discussion.
To dismantle what we're doing.
You're accusing the party leader of
Wiper
interfering with affairs in the counties.
Yes, he does.
But you as a governor, you're the leader of that county.
Yes.
Why is it not possible for yourself, or even Professor Kibwana, or even Mama Ngilu, to put the house of your respective counties in order? Whatever issues there are, sit down, discuss, and agree.
But they never issues. If you talk to MCAs, they tell us, Kalonzo calls them and tells them must finish Mutua. You must make sure nothing passes.
Is that supported
because
with evidence?
Yeah, there's evidence. We can call people to say that.
Okay.
We've been, I've even recorded conversations. You know, MCAs have recorded conversations and relayed them to me. I mean, it's totally embarrassing. So when you talk about destabilization, this is a man who wants to destabilize people so that there is no development, because it is easier to control people when they are suffering and poor than when they have money. And we are saying we want people to have money, so we want our people of Ukambani to be rich, to be wealthy, to live good lives, so that they can choose the leaders they want, not just be there at sycophancy over a leader who is not doing anything for them. And that's the fight we have.
All right, thank you so much.
But we are telling him, we don't want fakeness. We want our people to actually be able to be in a position of telling us, go look for things and come back.
All right.
Governor
Dr. from Mutua, those are your words. We don't have any evidence to support them that whatever you're saying about Kalonzo Musyoka, but all the same, we'll try and reach him and hear what he has to say about all these allegations, whether they are true or not. And thank you for making time for us on Daybreak, and wish you well in your work.
I'm happy and I'm glad. Ask Kalonzo Musyoka, is there something wrong with Kibwana, something wrong with the Mutua, something wrong with... There's everything wrong with anybody who says, wait a minute, does it have to be this way? It looks like it's either his way or no way.
When is the last time you spoke to him?
We spoke to him during his father's funeral, which he attended. And I went to say Pole, and we chatted. Before that, we met at a wedding where we talked. But the idea is...
Maybe you should nurture more conversations?
Oh, we do. But you see, you talk to somebody, and what he tells you is not what he does behind your back. So it's somebody, you are laughing with him, but he's holding a knife behind his back. And
let's not open that discussion again.
We want honest leaders.
Asante sana.
But thank you very much. But
Governor Mutua, it's really hard to stop you.
Yeah, I just want to tell our people of Machakos and Makueni and Kitui, a time of change has come. There's a new wind of revolution blowing, not of politics only, but mostly on development. We want, as the 3 governors, to be asked, ulifanya nini, and we show what we did for our people. At the end of the day, that's all that matters. Maendeleo, maendeleo, maendeleo.
Which team do you support at the APL?
Our National League.
Go away. All right, I asked that question because Sporty Monday is up next with Willis Raburu. They'll be looking at how the teams have been performing over the weekend, and of course the future in as far as that league is concerned. Thank you, Governor, for coming. And thank you, viewers, for watching and texting in your views on 22422 and at Sam Gituku at Citizen TV with the hashtag Daybreak. Of course, it continues after the break with Willis Raburu and his panelists. Back in a moment.